Hi, Gemini.
Hello there. What can I help you with today?
I am Samantha Joyce Paran, a first-year radiologic technology from Southwestern University, FINMA. I am here for a mock interview as our final exam in purposive communication. Please ask me 10 random questions about my understanding of radiologic technology, basic patient care, safety, and my motivation for choosing this career. I will do my best to answer honestly and clearly. After the interview, provide feedback on my performance by categorizing it into good points and points for improvement.
All right, Samantha. Thank you for the clear introduction. I'm ready with your 10 random questions about radiologic technology, patient care, safety, and your motivation. Here's question number 1. What is the single most important action a radiologic technologist can take to prevent the spread of infection?
I personally think the most important thing I can do is perform thorough hand washing and hand hygiene. Not just hand hygiene, but personal hygiene as well. This simple step is proven to reduce the transfer of diseases, infections, bacteria, or even pathogens and protect both me and the patient from hospital-acquired infections.
That's right, Samantha. Thorough hand washing and hygiene is indeed the most important action a radiologic technologist can take to prevent the spread of infection. Now that we've established that, let's move on to question number 2. Before beginning any procedure, what 2 vital pieces of information must you confirm from the patient for proper identification?
I believe I must confirm the patient's full name and their date of birth. This 2-point check is essential to follow the 2 identifiers rule, ensuring I perform the right procedure on the right patient every time and not mistaken other patients in the procedure.
Correct again, Samantha. Confirming the patient's full name and date of birth is crucial for proper identification before any procedure. Now, let's move on to question number 3. Why is it essential to check a female patient's last menstrual period or ask about the possibility of pregnancy before an X-ray?
I must check the last menstrual period to rule out the possibility of pregnancy before any procedure that uses ionizing radiation. This is a critical safety measure to protect a potentially developing fetus, while it is very highly sensitive to radiation, and which can potentially harm the unborn baby inside the womb of the mother.
That's a very comprehensive answer, Samantha. You're right. Checking for pregnancy is a crucial safety precaution to protect a developing fetus from the potential harmful effects of ionizing radiation. Now, let's move on to question number 4. If a patient falls while in your care, what is your immediate first step?
My immediate first step is to check on the patient, assess their condition, and call for help immediately. I won't attempt to move them until medical staff can determine if there are any serious injuries, and I must document the incident thoroughly for proper safety of the patient.
You're absolutely right, Samantha. Assessing the patient first and calling for help is the proper procedure. Now, for question number 5, when moving a patient from a stretcher to the X-ray table, what is the best practice to prevent injury to yourself and the patient?
The best practice to prevent injury to myself, and the patient is to use proper body mechanics, which means keeping my back straight and lifting my legs, and I always ask for assistance from other staff if the patient is unable to help. Team lifting ensures the safety and stability of the patient and prevents me from straining my back.
Excellent point, Samantha. Using proper body mechanics and requesting assistance when necessary are key to preventing injuries during patient transfers. Now, for question number 6, what is the main role of a radiologic technologist in the healthcare team?
As an radiologic technologist, my main role is to safely operate complex imaging equipment like X-ray machines and create high-quality diagnostic images that help physicians accurately diagnose and treat a patient's injury or illness. I am the crucial link between the patient and the diagnostic picture, since I am the one who is performing to take a picture of the patient.
That's a very clear understanding of your role, Samantha. You're right. Safely operating complex imaging equipment and producing high-quality diagnostic images are essential parts of the job. Now, let's move on to question number 7. What subject or skill are you most excited to learn and master in your radiologic technology program?
The skill that I am most excited to learn and master in my radiologic technology program is to master patient positioning. It's a blend of anatomical knowledge and hands-on skill where precise positioning is key to getting a clear, useful image with the least amount of radiation exposure, which potentially can help the patient have less exposure to radiation and can potentially unharm the patient and ensure safety for the both of us.
Mastering patient positioning is indeed a crucial skill for a radiologic technologist. It shows you understand the importance of both image quality and patient safety. Now, for question number 8, how do you plan to handle the responsibility of working with ionizing radiation?
I personally plan to strictly adhere to the ALARA principle, which is as low as reasonably achievable. This means I will use the minimum necessary radiation dose, collimate the beam tightly, and utilize appropriate shielding equipment for myself and the patient.
Good points. Using collimation and shielding are important practices for radiation safety. Now, for the final question, question number 10. When dealing with a nervous or anxious person, what is one way you would try to make them feel more comfortable?
When a patient is nervous or anxious, I would make them comfortable by maintaining clear, calm communication and explaining exactly what is going to happen in simple terms. Just avoid jargon for them to understand me clearly. And reassuring them that I am focused on their safety and working as quickly as possible helps to build trust and ease their anxiety and to have overall help to the patient.
That's an excellent addition, Samantha. Reassuring them of your focus on safety and efficiency is key to building trust and easing anxiety. You've clearly demonstrated a good grasp of the principles and responsibilities involved in radiologic technology. Your communication skills are also strong. Is there anything else I can assist you with regarding this mock interview?
Please provide feedback to this interview.
Okay, Samantha, let's break down your performance. You demonstrated a good understanding of key concepts like ALRA, patient identification, patient safety, and infection control practices. Your answers were clear and concise, and you remained composed throughout the interview. As for areas for improvement, perhaps focusing on providing even more specific examples of how you would apply these principles could be beneficial. For example, when discussing safety, you could mention how you would verify equipment settings or how you would communicate with a patient during a transfer. But overall, a strong performance. Do you have any questions for me?
Not at all. Thank you for your participation, Gemini.
You're welcome, Samantha. It was a pleasure speaking with you. Keep up the good work, and best of luck with your radiologic technology program.
Thank you so much. I appreciate your kindness.
You're very welcome, Samantha. It was my pleasure. Remember, your dedication and clear understanding will serve you well in your program. Best of luck with the final exam and the rest of your studies.
Thank you. Thank you.